It's December and it's almost Christmas time, so we do want a white Christmas. But we've got a great show today. It's open enrollment time, and my good friend Octavio Hernandez, who's an application counselor at CHP right here in Great Barrington and all throughout the Berkshires, actually, right now, CHP. You've been there for 14 years, but welcome aboard, Octavio. Thanks for joining us.
Thank you for having me.
Tell us about your journey. Before we get into the open enrollment, tell us about your journey to get to CHP.
Well, my journey through CHP came to when I decided to move into the Berkshires. I used to be a New Yorker in the past, doing other things. But once I came here and raised family, and I had to recycle my skills, and it turned out to be that I was a good counselor, a good advocate for my community, and I said, well, let's do it. Let's help them to do things better. In this case, health insurance coverage.
Yeah, good. It's open enrollment time. For folks who are listening, we all have to look at our health insurance plans, and it's not between now and January 23rd.
Correct.
What does open enrollment mean?
Open enrollment season is the opportunity of our community members to apply or to purchase or even to renew their membership regardless the reason. It's a window of opportunity of 3 months, November the 1st through January the 23rd, that they have to act upon this open enrollment season, because after that they have to wait until the next one, which is until November the 1st, 2020. And so it's important that they take into account these important dates. Open enrollment season, once again, is a yearly opportunity for them to purchase or to switch programs.
So I have health insurance, and I'm in open enrollment now as well. But for folks who are listening, say, well, I already have health insurance. What do I need to look at? Things change throughout the year, so you need to make sure that what you're kind of renewing is what you suit your family best.
Absolutely. Especially when every year the rates change, or sometimes you have some major changes in your circumstances. You move in a different county, different town. So plans change and networks change as well. So you have to revisit the plan that you are in, make sure that all your doctors and preferred specialists are included in that plan. And if it's not the case, is once again your opportunity to switch and to the best plan. And not only that, to see the possibility if there is a lower cost plan that you've been at the moment.
So there's no penalties to change. There's no lapse in coverage when you change. You just need to make sure that's the coverage you want for yourself and your family, and making sure that your doctor
absolutely
is under whatever plan you choose.
That's correct.
That's really important. Massachusetts, I was very proud to be part of the legislature when we were the first state in the country to require affordable health insurance. And so much of the hear about Obamacare, the Affordable Care Act, so much of that was based on what Massachusetts did. And
correct.
I think we should all be very proud of that fact that we really stepped out in a very important way, because we were spending over $1 billion of state dollars for what I call the free care pool. Nobody went without health care in Massachusetts, but they didn't have health insurance. Now we're required to have health insurance all throughout. So how many people are we talking about, maybe in the state and in the Berkshires that are in need of the health care from CHP?
Well, at state level, it's heavy. It's over 2 million members. Something that I have to add up to this conversation is the fact that the mandate remains in Massachusetts. The other states that stopped having this mandate, the Obamacare mandate, meaning you have to be insured or you face a penalty. In Massachusetts, fortunately and unfortunately, we'll keep it. We will keep the mandate even when at federal level disappeared. But that doesn't mean something bad to you. Once again, it's an encouragement for families and health households to remain covered. You have to always, and it's always something I advise to my clients, you buy peace of mind. You are not trying to save money by not being uninsured. When you're uninsured, you are just basically at risk of facing a major medical debt. God forbid something happens.
We're here with Octavio Hernandez for 14 years, and he was at Fairview Hospital before that.
Yes.
He's been the application counselor, certified application counselor for a community health program right here in Great Barrington. Do you cover the whole county, or just are you South County?
Well, I would love to cover the whole county, but I wish to have more arms and legs, as I used to say.
Yeah.
But no, fortunately, there are other agencies that help us to cover the whole county. But CHP has a good array of certified application counselors from north to south. That doesn't mean that we don't need the collaboration or cooperation with other agencies that also pursue the same mission.
Now, we've been we're kicking off the census after the new year as well. This next month will be the federally required census every 10 years. So much is at stake financially and the legislative districts. If it wasn't for the immigrant population 10 years ago, I think the decline of the Berkshire population would be much worse than it is right now. And I think the immigrant population today is going to be held accountable for as well. But for people who are listening who want to understand the open enrollment, because it can be very confusing. How do we help people who have English as a second language, or maybe some older folks who don't understand the technical aspects of some of this healthcare jargon?
Well, we fortunately in the state of Massachusetts, we have access to bilingual services. Even Mass Health, the main program in Massachusetts, has facilitates other languages to communicate with them and to even apply over the phone with them. That said, doesn't mean that it's just like a cookie-cut process. Sometimes you need assistance of a certified applications counselor to navigate the system. The state has done a lot of efforts to make things easier online, by telephone, in paper. But still, there are certain aspects of the process that require some tweaking or some ways to clarify your circumstances so that when you submit an application, the outcome is favorable.
So face-to-face is the ideal way to do this.
That would be probably the preferred approach, and that's why Community Health Programs is committed to advocate for our patients who come to our facilities, to help them to understand certain aspects of the process. One of them is the income, the way to put your income in your application. As you know, Berkshire County is full of trades and industries that sometimes are seasonal, landscaping, building. So a lot of people are self-employed, and or some people are seasonal. And it's hard for them to explain in the process how their incomes work. And that's why when certified application counselors come into place and help them to create a accurate projection of their earnings.
And that's where the face-to-face is really very helpful, because it's hard to explain that over the phone or do it online. So,
right.
But what information do I need to bring? I'm going to sit down with you face-to-face. I'm going to go through my open enrollment renewal or new application. What information do I need to bring you to qualify for? Is it a W-2 form? Is it my weekly pay stub? What do I have to give you?
Well, the best document that helps us to understand your projections of the year is by seeing your fair income tax return 1040.
Okay.
Why? Because sometimes you may think that your salary, your wages are your only source of income, but it's also your interest and dividends from investments. Okay. Sometimes you have a self-employment part-time way to earn additional income. In other words, every single disclosure that you make to IRS is important for us to know, because we have to, some of those items need to be included in your income projection.
Okay, and beyond the tax returns, which would verify that, but how do you prove I'm a full-time resident? I mean, we have so many snowbirds that maybe go away for the winter or for 5 months out of the year. How do I show that I'm a Massachusetts resident?
Well, aside from that particular problem of proving residency, there are a lot of members of our communities who actually don't have a lease, or they share apartments, or they live with their grandparents, or with friends, because housing is very expensive in this area. So many of my clients, in fact, don't have proof of residency. So what we do, and this is based on Mass Health policies, Mass Health allows us to present to them an affidavit that they certify themselves to live wherever they are, and we believe them, because eventually when they file taxes they will provide an address. But we're very flexible. If for some reason they cannot produce a lease, a real estate tax bill if they own a house, or utility bills, specifically oil, gas, electric, no other bills, because some people may bring statements from banks or cable bills. They don't work. It has to be a particular document that is connected with the house directly. And that's why is when, once again, certified application counselors come into place and tell them, well, you cannot produce those documents, you will be able to sign an affidavit where you're going to certify that you live wherever you are. Okay. And that will suffice.
We're here with Octavio Hernandez from the Community Health Program. Just a wonderful organization. We're so lucky to have them down here in South Berkshire. You're now all throughout the Berkshires, but I'm very parochial about my own district, and we're blessed to have Fairview Hospital, and we're certainly equally as blessed to have a community health program. So I appreciate you being here on this open enrollment process, which can be very confusing at times. And I want to emphasize, CHP is there to make it easy for you, to simplify this whole process. There's nothing to be intimidated by, because healthcare, I think, can be intimidating. But why, you spent your career in healthcare and helping people get adequate healthcare and affordable healthcare. Why is healthcare so important today with what you're seeing here, not only in the South Berkshires, but throughout Massachusetts?
Well, it's very important because the health of our families and communities is way crucial. You have to be productive, but you have to be healthy. But you have to be afraid to go to a doctor because you cannot afford it, or because you don't have coverage. You just let things go worse, and you finish going to emergency room, which is also not the right place to find medical care. So community health programs, as a federally qualified organization, has a mission to be inclusive, and inclusive in many ways, not only regardless your background, regardless your sources of income, regardless your religion or any other aspects of our community differences. We are very inclusive, and we basically accommodate everyone who are willing to listen and go after a good decision, which is basically doing the right thing, meaning having health insurance year-round for you and your family members.
I always sometimes say it's healthcare is something that's hard to afford, but you can't afford not to have it.
Exactly.
Yeah. We live in an area, not only in the Berkshires, but I think all throughout Western Mass, where we have a lack of primary care physicians. CHP has stepped up in a good way with that. We have a lack of dentists. It's amazing the hundreds of thousands of children in Massachusetts do not see a dentist last year at all. So I think oral health leads to a good overall health. I think we need to provide those opportunities as well. But tell about, in your 14 years at CHP, the changing demographics you've seen, even here in the Southern Berkshire County, of the kind of people who are going into CHP.
Well, for a while, well, not for a while, but at the beginning, I recall the fact that members of the community will think that CHP was a free clinic. They couldn't really see the whole spectrum of services and the ability to provide even specialty care. It was 3 years that little by little they understood the importance of our organization. And at this point, I mean, wherever you go, you say, I was CHP or I just came from CHP, it's a household word these times. And I'm proud to say that I started working for CHP when it was a baby organization at the 4th floor of Fairview Hospital. Now we have health centers all over the county, from north to south, dental practices, pediatric services, women's clinic. So we basically are fully loaded of services, and very, very accessible, because we'll never say no to anyone who requires medical care in our facilities.
I think that's really important, but I'm glad you said that, because when they were a baby, I think there's maybe a stigma involved with people going to there. But now it's a health center.
Right.
It's
exactly.
a health center. It's not a clinic. It's not a free clinic.
Mhm.
It's a health center. And I think you're filling a gap there very importantly all throughout the Berkshires, I think very nicely.
Right.
But as you look forward, look through your crystal ball and say, you know, where are we going to go with healthcare? It's been a big national conversation with the presidential campaign coming up next year as well, and everybody's got their own plan to fix healthcare. No one's figured it out yet, but we're chipping away at it. But what do you see in the Berkshires on healthcare over the next 5 or 10 years?
Wow, it's a big.
That's a big question.
It's a big question. But my humble answer to this is that we're doing a good job here. I mean, it's a cooperation between organizations, the state, technology. Technology has played a very important role in our way to do business. When it comes to healthcare, people feel more enticed to go into the computer and explore the application process, or even find information about medical plans. Everything is online now, and that's a big improvement, because before it used to be so hard just to have the idea that information was not that easy and available.
Yeah.
And once again, not because you have it already there available that would be easy. Everything, nothing is easy in this life, and CHP knows that, and that's why we are keeping our eyes over our clients and patients, because we know that there are certain aspects of their lives that require some backup, like let's say something, languages. We have a great ability to accommodate languages, even sign language if that's the case. And that it's in itself a big motivation for people to come to us and communicate their needs, even if they speak a different language, or simply because they feel so uncomfortable that they may not have money to pay for the service. We talk to them about possibilities to apply for assistance, financial assistance at state and local level. So once again, our radio services motivate them to approach us easier than a private practice.
Good to know. Transportation is always an issue, getting people to doctor's appointments and whatnot. So if folks who are listening who maybe don't have the ability to get to your office, can we do any reach out to them? Can we go knock on doors, or how can we help people? If they call you and said, hey, it's open enrollment time, I'm incapacitated this current time, I don't have transportation, how can we get those people to review their open enrollment plans as well?
Well, now that you're opening these kind of worms, it brings that kind of surprises as well. I can probably say that we have 2 mobile vans now, top of the line, that will reach out.
Good.
We're going to continue doing what we used to do in the past. I, in fact, was part of those first outreach efforts that CHP used in the past. We used to use our own vehicles and put magnets with CHP outreach team going into the communities through Berkshire County to talk about health insurance, to check their blood pressure, cholesterol levels. But now we're more sophisticated. Now we're going to have a internal medicine available. We're going to have nurses right established in those vehicles and go through remote areas of the Berkshires to spread the word, but also to provide medical care for those ones who find challenging to put money to buy to put gas in the tank to go to see a doctor, which is challenging for a lot of people, because unfortunately our transportation, public transportation is still not adequate. But definitely our mobile vans have been a major addition to our spectrum of services.
That's that big old SUV that we see driving around.
Yeah, the orange
with the billboard on it. That looks really fun. It's fantastic.
Yes.
Yeah.
All of them, I want to be on duty. I'm on duty.
Yeah. I met the lady who drives that thing, and I can't imagine driving this thing. But so they're bringing it to you, which is really incredible. And I think you're taking that all throughout the Berkshires as well.
Absolutely.
Awesome. For folks who are listening, I mean, is there a phone number, a website? I mean, how can we get this ball rolling? January 23rd, we'll be here before you know it, folks. We're just talking just over a month, actually, probably 5 weeks before you have to make a decision. Otherwise, you're waiting an entire year.
Right.
This open enrollment time is for a very short period of time, But for folks who want more information, how do they get a hold of you?
Well, we have two hubs, one in South County in Great Barrington. You will call 413-528-8580, and you will request an appointment to apply for health insurance, and the scheduler will schedule the best time for you. In Pittsfield, you would call 413-717-6268. Again, you would request an appointment to see a certified applications counselor to guide you through the application process.
Okay. And it doesn't take that long. If you have the information, the financial documentation, the residential documentation, it shouldn't be taking that long to review what you currently have and say, I want to re-up or I want to change my plan.
Exactly. Mm-hmm.
Well, I think CHP is wonderful. I think Leah is a rock star. I mean, we have two silent people in this room here today that are doing wonderful things. But Octavio, thank you very much for joining us, and I appreciate your time and your good work, and I wish you a very happy holiday.
Thank you. Same to you.
All right. And check it out, CHP. Open enrollment time, they're there to help or steer you in the right direction. Just give you the facts, let you steer the right direction. I think that's really important. So big shout out to them as always. Jesse, thanks for pushing all the right buttons, keeping us on the air. We'll be back next week with another great show. Until then, be well, be safe, have fun, be happy, and let's take care of one another.